Today, we will talk about the role of neurocircuits in the pathogenesis of major depression, another gift we have received in the last 15 or 20 years from the world of research psychiatry. So, let's talk about the pyramid of depression. And we, of course, have talked about neurotransmitters now for 50 years, but that's not enough. We have to talk about neurogenesis, neuronal plasticity, but we have to talk about neural circuits because, as I'm showing you here, it is indeed these brain networks that help us understand both what depression is and how do we help our patients overcome it. So it is this cascade. If we don't talk about neural circuits in depression, we will never understand the importance of cognitive control issues, control of negative affect. How do we understand anxious avoidance? And how do we understand, you got it, anhedonia? So to do that, I first want you to get a sense of the different brain structures involved in the various neurocircuits we'll be discussing: the prefrontal cortex, the anterior cingulate cortex, the hippocampus, and amygdala. They're all involved in depression as well as the reward circuit deficits that are so important. Primarily, there are three networks of interest to those of us who are interested in major depression: the salience network, the default mode network, and the central executive network. These three networks, when they're dysfunctional, do lead to the development of major depression. And our new neuroimaging techniques, certainly the older techniques of PET scanning, functional MRI scannings, has been augmented with magnetic resonance spectroscopy. So we can really dive into the brain to better understand these issues. Neurocircuits and neurogenesis are deeply connected. This is the reason why we cannot talk about one or the other in isolation. What helps neurogenesis helps neural circuit get reconnected. And these functional disconnectivity between these three networks is what leads to depression. The reverse is equally true. Interventions that correct these disruptions also correct the pathogenesis of depression. So the first network we should talk about is the default mode network. This is involved in self-thinking, but it's also involved in mind wandering. It is overly excessively active in major depression, which probably is the reason why patients with depression so often ruminate. The default mode network is too strong, and the disruption of this is indeed a therapeutic target for us. The salience network is the great switch of the brain. It helps us switch out of the default mode network into the central executive network. And when this is dysfunctional, our poor patients get stuck in the default mode network. By the way, these networks are primarily driven by glutamate. And glutamate interventions are emerging as a rapid-acting set of antidepressants in order to help us with this dynamic switching between various networks. The third network of interest is the attention circuit and cognitive control network, also known as the central executive network. This allows us to pay attention, to use cognition in order to ward off negative emotions and also to feel joy. So in terms of the treatment of anhedonia, we need to be mindful of all of these circuits. By the way, anxious distressed specifier is a big deal in major depression, and disrupting that is very important. That's why a number of atypicals, specifically if they have glutamatergic interventions, are thought to be very good treatments for anxious avoidance. Anhedonia has finally reemerged as a topic of great conversation, but it's hard to talk about anhedonia without talking about these network circuit dysfunctions. That's why I'm so encouraging of us understanding not just the symptoms of our patients, but what underlies it. And what underlies it does appear to be these network dysfunctions that are so prominent in major depression. We even have a good idea where the neuroanatomy is of anhedonia, anxious distress, depression in general. It is the anterior cingulate, particularly the SG, subgenual anterior cingulate cortex, when there's dysfunctionality in its connection with the limbic system, with the prefrontal cortex, the patient presents with the classic sets of symptoms of too many negative symptoms and not enough cognitive control over them. That's why glutamate is emerging as a rapidly growing star in the field. As I said before, the default mode network appears to be a real star in our understanding of the neurocircuitry, and its excessive overactivity is part of the problem for our patients. In terms of salience, we need the salience network to be a dynamic, rapid switcher, and psychotherapy, by the way, really helps with this. So when we think about networks, we should not just focus on medications, but also lifestyle medicine, also psychotherapy. Those really do help in the improvement of all three of these networks. Isn't that wonderful news? That we can practice quite holistically in order to help our symptoms. And the clinical implications are quite obvious. It's not just academic understanding of these disorders, but also how do we therapeutically intervene. So those of us who opt for personalized approaches, who think about treatment targets, we think about rapid-acting antidepressants, be they medications or non-medications, are doing the right thing by our patients. And please remember, neural circuitry and neurogenesis are tied. They are really conjoint twins, really connected at the hip. We should not separate one over the other or think one is more important than the other in our quest to help our patients. Chronic stress is indeed disrupted in our patients with major depression, their ability to maintain it. And that's why this conversation about circuits is just so very important. So think about glutamatergic interventions that can actually be quite helpful in such patients. And in conclusion, I offer you the same pyramid I had shown you before, but please look. The foundation is neurotransmitters. We should be experts at it. But as you keep going up, we should think about hippocampal neurogenesis, neural plasticity, neural circuits, and of course, brain networks, because that is the royal road to success. I hope this quick introduction to the role of neural circuits and brain networks was of interest to you. Goodbye for now.